Your title itself is scary, orthopedic surgeon, right? You think that, oh my gosh, he has to do surgery on me, but that's not necessarily the case, right?
Ideally not. I'd say over 90% of the people that we see as orthopedic surgeons don't actually do surgery. It's usually just the 10% that do. So, as usually the end of the line specialist, it's our job, to refer the doctor or us to FRCSC patients who are also benefit from the end-of-life treatment, which is surgery, or is there something you can do before that that can sort of optimize the function of your surgery, get it back in shape and whatnot. Without surgery, surgery can't do surgery. But once we cut it in, mess around with the science, sorry. There's not much we can do to do that. So we really want that to be double-eyes and try.
And so, not to get into the gory details, but I've seen surgeries, and you're getting in there, you're cutting, you're doing all that stuff. So, are you saying that we should try to avoid that?
I think it's in everyone's best interest to try to avoid these ways. Everybody, I get the question, if you're me, or if I was your mom, or if I was your dad, what would you do? I hate that question. But my answer is almost unanimously, I would probably try to avoid operation if I could. Maybe I know too much, maybe, it's difficult for me to put myself in your shoes. But yeah, my mom deals with the same problems as all the other patients that I see deal with. And she asks me herself, what do I do? And, it's the same answer. It's try to avoid operations. Again, once you get in there, you can't undo what you do. Everything else doesn't have it downside. And if other things don't work, then, and you're confident that you've tried everything under the sun, then maybe you're at that stage. But you have to be mentally prepared, physically prepared, and you have to have sort of the right story, right diagnosis, right kind of radiology changes for us to be confident in the surgeon that will be a big difference. And so if all that doesn't line up, it shouldn't be our job to try to sell you an operation. That's terrible. Most of what should be done is you try to convince us that I've done A if you said it hasn't worked and now we do operations. But then it's okay, let's talk. That's my philosophy. That may not be all of everybody's philosophy within my area of expertise, but that's my philosophy.
And I actually like that. And I think the pertinent question here is, has that philosophy changed? I mean, it may not be everybody's philosophy, but over the years, do you think it's changed from let's just replace that knee, let's just replace that hip, to let's try to get you healthy and do everything we can?
Yeah, I think probably the last 5 years, a lot of, I think even the public's perception has changed, the whole mentality around, a lot of the days, sure, maybe 4 years ago, we haven't been around that much, but, doctors, whatever doctor says goes. Right? You just trust whatever he or she says. Now patients usually come armed with, the amount of stack of paperwork that they think I have to, 50 minutes to read through. They're educating themselves, right or wrong. They're trying to educate themselves, and they kind of try to have an educated discussion, which I don't think is a bad thing. I can put a lot of their information, misinformation in context, for or against, but I think that itself has changed the philosophy that you sort of have to now listen to the patient a lot of times. You eventually should, but it's not, one of the days where I look at an x-ray and, that old back screen, and, oh yeah, for instance, operating, and the patient's just okay. They're no different to me. There's a wealth of information out there, things that they have access to that's okay. A lot of times they come to me asking questions that I would probably ask them anyways. Right? So I think the philosophy change has been almost patient-driven, just armed with more information, more options, and they're taking it upon themselves. Again, maybe more in the last 5 years, maybe there's things that happen in the last 5 years in this world, but they're trying to get themselves a little bit better educated, and that sort of shifted the way that we have to do this.
And so when it comes to joint health, because that's essentially what it's coming down to, what do you think is the most important thing to do to try to maintain integrity of joints?
I'm a joint surgeon, right? And so, for the most part, and again, I get asked that question all the time. For me, I'm the kind of surgeon that's going to try to say, ideally to get you back to doing anything you want to do, just pain-free or less pain. To a point where it's more. I'm not the kind of surgeon who's going to say, go sit on a couch for the next 18 years of your life, yeah, you're evil. That's not good for anybody's mental health. I'm just sure you're talking about mental health and how it plays in every aspect of life. So if I can gauge your level where you're functional but relatively pain-free, then that's my goal. That's the end, because that's all surgery's goal is, I think, at the same time too, right? So for me, the most important thing for any joint health, I think, is moving. Right? I mean, it's not a lot here at the Foreign Motion Expo, right? So, moving is a relative term for different people, right? Whether you're a 35-year-old guy with a certain bone, or whether you're an 85-year-old person with a certain bone. But just getting moving is, to me, the most important thing, because muscles, you don't use them, you lose them. I mean, that's very well established in science. And muscles really are the driver of joint health, right? If you stop having the support of the muscles around a joint, then the joint itself starts to run the forces that we're not necessarily designed to take, especially when you're, especially as you age, right? When things start to generate just the rate. And so we have that support structure around the joint, aka the muscles, the tendons, to take those forces, so the bones and cartilage don't have to. And that's going to be your best bet to try to avoid deterioration of that joint. And there's other things that are very much like diet, such as huge thing, right? Like, not like going on a fat diet, but like what you put in your diet. I think is, probably something that we as surgeons of not taking enough education on ourselves. We're trained in a very traditional sense where we don't learn anything about nutrition. It's zero. You might have one hour lecture. It's sad. It really is. I went to medical school in the last decade, 2009-13, so maybe that's a little different for that later, but it's not. It's just not something that really, there's other people that really know that stuff, right? And so it's sad, but I think a big part of joint health goes into what we're looking at, like most other things. Arthritis, the word labus, sinusitis is inflammation. Appendicitis, pancreatitis, all these are inflamed things, right? And so arthritis, most of the people here probably know somebody that has it, is an inflammatory joint disease. How do you get rid of inflammation? There's lots of things. But one of the things is there's so many things you can do with what we put in our body that can help at least reduce it. But it may not be the magic wand. But if you're going to do one thing, I can only do so much with my hands and my brain. But if you can do one thing, start with the bare bones of what you put in your body to try to reduce it wherever you can to get that inflammation down. You'd be surprised how well the pain goes down.
I'm glad that you said that, because diet really is important. And that brings me to the next question. How does being overweight impact your joints?
Quite significant. I think, in the Western traditional diet that we have here, is obviously a bit of an epidemic, the obesity. Not only do you have more inflammation, you get more overweight, right? It's called metabolic syndrome of being overweight and and all that stuff that can go along associated with the weight on itself. Just the contact forces that go through your head. You'll see up to 7 times your body weight with each step you take, whether it's a walk or a run. So if you're somebody who weighs 40 pounds overweight, times that by up to 7, and that's much more of a joint reaction force your hip actually sees. And so because there's a multiplying factor, right? Even 10 to 20 pounds of weight loss can knock off a huge amount of forces off the joint, giving you the initial repair. To the point where even that will be maybe from symptomatic of the joint to something that's decent. Right? It doesn't take a whole lifestyle change. It's just 10 to 20 pounds. You can do that over a few months. It's not that hard, but it would be a huge thing. The problem is it's very hard for me to have a conversation with people. It's a big stigma around it. The last thing what you're doing as a doctor is telling somebody, the interpretation of all the fact, that's not what we want. What we want to do is try to promote health, right? And it doesn't take much. If you're 40 pounds overweight, you lose 10, that's huge. If you 30% of your pain ratio. If you have an 8 to 10 pain, you lose that by 30%. Maybe now you're at 5%. Which maybe something that's going to be able to get you to eat as much as you used to be. Whether it be those long walks or what, maybe you're not shooting for anything, but even just going from 8 to 5 in terms of your pain state, huge.
And that can make a huge difference on somebody's quality of life, from 8 to 5. I mean, that might trigger them to be more active and want to be more engaged in doing physical. Right. So, what are your thoughts on running or jogging for physical activity?
I guess it all depends on what you've done in the past, what your body is sort of used to. I'm very much don't go from 0 to hero. If you were somebody who used to be a runner and you took a few years off, and maybe had a few life events that maybe put on a few pounds where you're motivated to get back, then you can probably get back to that. But if you've never really done much and you're 40 pounds overweight, I wouldn't suggest running being your first thing you could go do. It just may be too much. Having said that, I think it's a very great form of exercise. We're getting it all freaked out right after going out to run. I have bad knees. We know that from the studies that marathon runners, people who run for a living essentially, don't have any more arthritis than people who don't have arthritis. Right? So it's not the activity itself that causes the arthritis, but makes it worse. Again, it's a lot of the work that we do to support the joint with whatever activity we're doing. But the activity itself will not cause wear and tear. Most of it has to do with genetics. At the end of the day, it's Mother Nature, she will win. And it's how we can sort of control it. But walking or running or jogging are excellent form of exercise. There may be ways you can modify it. Maybe you don't run on pavement if you're on a track or a softer grass or something like that. Maybe better for knees. But I mean, again, not the kind of guy who's going to say don't run or don't walk because it's bad for me. I say, well, if you want to run, let's figure out a way to get you running.
And so even post-injury or post some sort of a procedure, let's say somebody came and saw you for a ACL tear or a tendon ligament tear, is getting back into physical activity always the end goal?
It should be. It should be. I mean, that's why we do operations too. We do operate because if that wasn't the goal, why would we do the operation? Tear ACL, and you don't really like to play soccer. Day-to-day stuff, your knee is fine. You're not sitting there falling over. Then why do you need stuff? You can do it as well as soccer because you're 17, you want to keep going. Right? If you're 65, you want to get a knee replacement, or if you don't want to do it from walking, then maybe you replace my feet. It's a lot of risk you take getting a knee replacement for not much added benefit. So the end goal should always be the same as or better functioning. We started with prior to the injury or the injury.
What I found fascinating about orthopedic surgeons and people who are dealing with joints is you don't necessarily want to do surgery if it's not necessary. But when it gets to the point where you're almost there, what are some of the other options that people could try to see if they can keep the joint alive a little bit longer?
Yeah, so I like to look at things as a bit of a pyramid or ladder with a few different rungs. Right? So first rung of the ladder, a lot of times people are doing that to some degree before they get to somebody like myself. Physiotherapy, bracing, anti-inflammatory medications, or whatever sort of alternative medicine as well, like sure the all that stuff, sometimes that's all sort of clean up bottom line. The top lung, I'll just sort of skip one or two, but the top lung is a surgery. Right? And again, not everybody's that. That's going to be at 5 to 10%. Right, 100% of people obviously have fun. Not everybody's at the front side. A lot of perfusion takes care of. 5 to 10% of people at a certain point read that top line. So that's a big chunk that we need in this middle. And so things that, from an orthopedic perspective, that I can do to sort of get you through that. Because for me, if you haven't done the bottom, you have built that foundation with the physio, with the proper nutrition, the showing of that you're motivated to and you're active enough to be able to do it. I don't think seeing these going to really give you a magical goal you want. Because yes, I can do things that do quite a few things like injections, right, which can definitely blow away from the joints, reverse the changes that the damage have done. But you sort of have to show me as well that you are motivated enough to get better. Because again, I can't do that magic wall. And so, even for sure, you got to show me that you are able to be a rehab. So a lot of times I send you a rehab before the surgery. If you're a very poor patient before surgery, then what do you think the outcomes will be after? Probably not going to be as good as it could be if you show us that you were good beforehand. And so, if you know, if you meet me in that middle one, or the middle spot of the pyramid, there's lots of things that I can do. Right? Injections being a main focus of that, because that's something that I can do with my hands. It's a surgery you can do where you can't go to a clinic with an osteopath or natural. You really hit these things. So I do quite a few injections. The main focus is pain reduction. I'm not going to be able to change the appearance of your exterior MRI from legs. That's not what we're looking for. Again, I treat people around pictures, right? So we go through the history, the physical pictures. For game plan, the idea is that, I don't treat the pictures. You get very bad in pictures, but if I can make you feel better, it's not complicated. And so that's the goal, to make you feel better. So injections is a big work of, not to square, if you're not ready for surgery, whether it be medically or even radiologically. We've done all 83% beforehand, and I'm sort of at the middle stone where, I can get you a lot of function. I can't say guarantee, but a lot of times I'm having a lot of success, 75%, 80% of the time, with very minimal, if any, downsides or risks. Right? Especially not like surgery does.
And so you said something interesting that if you're doing the work beforehand, so let's say you're at the point where you need surgery, and they opt for surgery, you encourage your patients to kind of engage in physical activity or get some sort of a physical therapist working on them to develop integrity and muscle strength prior to the surgery and then as well after.
Yeah, we call it pre-op and rehab. Right? So pre-op is good because if you have a problem that starts here, surgery's going to knock you down. Right? It's inevitable. Right? But if you have a problem that moves from pre-op to here, we're going to knock you down, but you just get back down there. And it's an easier climb back up. So I'm a huge proponent of physical therapy. Almost nothing is worth it. But definitely maintain muscle mass.
So, as an on-call surgeon, so if anybody's looking to find out a little bit more about Dr. Menna, he is on Instagram as the on-call surgeon. So, as an on-call surgeon, I'm sure that everybody's pitching to ask the same question. What are the most common things that come into the ER that are orthopedic issues?
So a lot of times you don't understand what my job is as a on-call. So as a specialist, you go into the emergency department with a problem, you usually see the emergency physician. And if they don't know what to do with you, or it's above their sort of area of expertise, then they can call me. They're going to call. And so then I go see the emergency department. I'd say the most common thing that we see is probably hip fractures, to be honest. Right? So that's 75 to it's by 108, obviously it's by our best. We go with the biggest part of the range, but I say 5 to 90-year-olds that just have falls from standing up and break their hip. And why does it happen? There are a combination of reasons. It's lack of mobility, balance. Some people have cognitive issues where they're just not able to sort of understand that maybe they need a walker, hop on a bed in the middle of the night, thinking they can go for a pee without it. There's also a lot of 75, 85, 90-year-olds that fall in operating. So what's the difference? Because I get that question all the time. I think the big difference is the fact that there's a lot of 75-year-olds that don't do much moving. There's a lot of 75-year-olds that do a lot of moving. Again, muscles pulling on bones are what strengthen bones. So resistance exercise, walking, all these things are strengthening bones. You don't strong bones, whether it be osteoporosis or for women, it's postmenopausal, right? Your hormones essentially destroy your bone strength, and so supplementation, hormone therapy, all these things help. If you don't have good bone strength, then yeah, just a simple fall can break your hip and potentially have a major impact in your life. And so rewind the clock back a decade, 2 or 3. It doesn't take much. Right amount of diet, exercise, weight bearing exercise, or resistance exercise to strengthen those bones. And you may save yourself from a life-altering injury where you're not able to have muscle.
What would be, so for those who don't know, I could fall on my hip and I necessarily won't break it, but between the ages of 75 and 80, 85, what makes the risk so much higher to fall and breaking it?
I think reaction time, right, or reflexes, right? So I think as we age, we kind of have that quick, put your hands up and brace yourself. So a lot of times it's just a harder impact right on the break. The 35-year-olds that come in with falls, it's going to be their wrist, right? Because they have to replace their fall with their wrist. At 75 or 80 or 85, you don't have that reflection. So you hit your hip, and the next thing that hits the floor is the head, right? And so it's probably a combination of that, plus again the bone strength. But you know, I think keeping things sharp, agile, and strong and moving well, you may reduce those risk factors of not being able to get your hands out in front of you fast enough to brace that fall.
When it comes to kids, I think that's a big concern for parents. Kids in sports, do you recommend like high impact sports? Do you try to shy away from that? What are your recommendations for kids in sports? Just because their bones and their joints are not fully developed yet or fully fused, is there any recommendations you give to parents?
Yeah, I've got kids and they like sports. I'm a big, I grew up playing sports. Trampoline with no padding outside, I'm a product of that generation still. So I don't think there's anything wrong with kids in sports. I think the safety equipment and the awareness has got much better than when I played 25, 30 years ago. But just know there are risks, right? The good thing about kids, especially for the young kids, is they heal pretty well, right? Rarely do we have to operate on kids for broken bones. It's not, super uncommon, but rarely do we have to. They just heal much faster, much better, and crooked bones find a way to straighten themselves out as they grow. And so we have to make it pretty bad for us to want to do an operation. So yes, inconvenient to have an injury in sport as a kid, but I think there's so much more benefits to kids playing sports than just bubble wrapping your child and being scared of something. The camaraderie, the teamwork, the confidence, all those things that can outweigh the risks of sport. And yeah, you can say I have a bit of a skewed view, like, do I let my kids go to these trampoline parks, which, can single-handedly keep me busy on a weekend? I mean, they still do, but yeah, that kind of stuff worries me. But I think, I'm also not the kind of parent who's going to not let his kid do anything because he's worried about it breaking it. It sort of comes with it. But I don't see a problem. I think it's, there's nothing better for me as a parent to see my kids having a blast doing something that looks like a ton of fun. Brings me that too.
Yeah, and it makes you want to jump in that trampoline without a pit and whatever it is. So let's say you have a child that actually did have a fracture and you had to operate. You said they generally heal quickly, but should parents be concerned about the long-term repercussions, or do kids generally heal and things work out, but the ligament and the tendon kind of get back into place?
Yeah, I think generally they heal better than what we would at our age. So that's probably the first part of the question to answer is they should be better than what we would. Where it differs is if they're really young, they can do their growth. Right, that's a bit of a different ball game because the growth rate is also the ball to grow from. We have different growth rates in the body that grow at different rates. And so if you have one that you've injured that's a high rate of growth in that area of the bone, then yeah, you may run into problems down the line if that growth rate doesn't really come. And so those are the areas where we will operate. So you have to turn that back to perfect for the biology to sort of reset itself as opposed to just stall. And we never go into details, and that's probably the spot where we would take things a bit more seriously what it involves politically. But, what we call long bones, like arms, legs, shins, ankles, wrists, all these things heal very well, very quickly. And, most times kids don't want to have a cast, not like adults. And, within a few weeks of them taking the cast off, they're running away from these kids.
So one last question about supplementation. What are your thoughts on taking certain supplements to